All right, good morning and welcome back to TV5 News at 9. It's time for Medical Moments with Covenant Healthcare, and joining us this morning is Dr. Bashar Al-Jayuski. So, Doctor, thank you so much for being here with us this morning.
Thank you for having me.
So, tell us about something interesting. It's called a Watchman. What is that? I've never heard of that before, and I'm sure plenty of people haven't either. So what is that?
So Watchman is relatively new technology, for the last few years. It's a device that we can implant in the heart to prevent strokes. And it is specific for patients with irregular heartbeat called atrial fibrillation.
Heard of that?
Yeah, commonly people call it AFib.
Yeah.
It is a very common irregular heartbeat, and one of the bad things about it is that when the heart beats irregularly, basically the left upper chamber of the heart is not in sync with the lower chamber of the heart. It can lead to blood clots forming inside the left upper chamber of the heart, and if these blood clots go to the brain, they can cause a stroke. And basically, if patients can be on blood thinners, that's the treatment. If you basically blood thinners like Coumadin, Eliquis, Xarelto. So basically, if you can be on blood thinners to prevent the development of blood clots, then that's the standard of care. But some patients cannot tolerate the blood thinners, and that's when this device can be implanted in these patients who cannot take blood thinners for their AFib as a replacement for the blood thinners. So this way, they can still be protected from a stroke without having to be on the blood thinner that they cannot tolerate.
So tell me a little bit about what type of patients would this be for? Is it specifically for people who just have an AFib, or is it for other type of patients as well?
It's specifically for patients with atrial fibrillation. So it's not even approved for other kind of irregular heartbeats. It has to be atrial fibrillation. And now, not every patient with atrial fibrillation needs to be on blood thinners. So we have a scoring system we use to determine which patients with atrial fibrillation are at high risk of developing blood clots. So if you are somebody with atrial fibrillation, specifically atrial fibrillation not related to a valvular heart disease, so it's called non-valvular atrial fibrillation, plus you have a high score on this scoring sheet we use, then you have to be on blood thinners. But if you cannot take the blood thinners, then Watchman will be an option for you, which can be implanted in a very minimally invasive technique through a small incision through the groin. It's not open heart surgery, it's really catheter-based technology.
So tell us a little bit about strokes, because a lot of us, we know what a stroke is, but some of us may not know how it actually impacts the body. So can you break that down for us?
Yes. So frequently I see that most of my patients get confused between a stroke and a heart attack. They think of a stroke as a heart attack. But really, a stroke is basically a blood clot going to an artery in the brain, and hence you will lose the function of that area of the brain. So if you have a blood clot in the area of the brain that controls your arm, you're going to lose your ability to control your arm. You cannot feel your arm. Or if a blood clot goes to the area controlling your speech, you're going to lose your ability to speak fluently or find words. So that's basically what a stroke is. A stroke is basically loss of a neurological function of the brain because of a blood clot going to one of the arteries of the brain, compared to a heart attack, which is a blood clot also, but it's in the arteries of the heart. And so basically the stroke will eventually lead to losing the ability to talk, losing the ability to walk, and sometimes confusion and comprehension and neurological function loss, basically.
With some people getting confused on the difference between a stroke and a heart attack, what are some ways that you can, or some symptoms of knowing that a stroke may be coming on?
So it's basically, that's a very good question. So stroke is basically anything that has to do with the neurological function. And we basically usually, just like we said earlier, so basically loss of the ability to speak, difficulty finding words, confusion, sudden dizziness, loss of sensation, loss of the motor function in the arms or the hands, and also facial asymmetry. So asymmetry of the facial expression, that these are mainly the symptoms of a stroke. Whereas a heart attack, it's usually when you have sudden chest pain, shortness of breath, associated sometimes with palpitations, dizziness, or even passing out.
So if someone has questions about maybe they have an AFib or they know someone who does and they're interested in the Watchman, who should they give a call to?
So I think the first thing is obviously you should reach out to your family doctor or your primary care physician or their cardiologist if they have one. But if not, we at the Structural Heart Disease Program at Covenant, we're available. If they have any questions for our program, we're happy to help and guide them through this process.
What is your passion behind this with, treating patients with heart issues and heart disease? Where's your passion in that?
Well, I think the passion of myself and every physician is to have an impact or a change in the lives of our patients, preserving life and improving the quality of life. But I'm so passionate about these medical equipment and technology we currently have because they are minimally invasive, they're extremely safe, and recovery is extremely quick compared to open heart surgery. And now we can do things in a very minimally invasive way, and these changes in medicine are changing the lives of our patients tremendously. So that's my passion about it, is these changes in medicine changing the lives of our patients.
That's what I was going to say. This is life-changing technology.
True.
Well, doctor, we thank you so much for being in today and teaching us all about AFibs and heart disease and the difference between a stroke and a heart attack. We just learned so much this morning. So if you would like any additional information on today's topic, all you have to do is head over to the Hot Links page on WNEM.com. We'll be right back.